This is the Daily Medical News by MD Edge, where we bring you the top stories in clinical medicine, followed by a deeper dive into the day's top story. Today is Monday, November 4th. I'm the voice of MD Edge podcasts, Nick Andrews. All of the stories you hear today are available in their full written form at mdedge.com. You can find links to the stories in the show notes. Coming up later, a closer look at how one expert says you can increase adherence in children with asthma. But before we start, we'd like to ask for your help to make this podcast a little better. Please take a moment to complete our short listener survey by following the link in the show notes. Questions include a little bit about you and a little bit about what kind of podcast material you like. We would greatly appreciate your feedback, and of course, we appreciate you joining us for the top stories in clinical medicine. The survey is, of course, completely anonymous. Okay, it's time now for the top stories in medicine. We begin today with an update on 2020 health plans. The average family of four will see a 2.4% drop in its premium from a benchmark plan on the HealthCare.gov marketplace in the year 2020 compared with prices in 2019. This is according to an update from the Centers for Medicare and Medicaid Services. Despite the drop for 2020 plans, the $1,520 premium for coverage will be 74% higher than the average back in 2016, which was $873. The average premium for a 27-year-old single person is now $388, which, like family coverage, is slightly lower than 2019, but more than 60% higher than it was back in 2016. Consumers who are looking for healthcare coverage on one of the 38 state exchanges during the open enrollment period will have more choices. The average number of qualified health plans available to enrollees will be nearly 38 for the 2020 plan year, which is way up from the 26 plans available in 2019 and the 25 plans available in 2018. The number of companies that issued those plans also rose for the second consecutive year. They went from 132 companies in 2018 to 155 in 2019 and 175 in 2020. And now an update on the vaping injury numbers. Vaping-associated lung injury, or EVALI, cases have now reached 1,888 at the time of this recording. The updated numbers come from the CDC and also show that there have been 37 confirmed deaths. Deaths have occurred in 24 states and the District of Columbia. There have been 3 deaths in California, Georgia, Indiana, and Minnesota. 2 deaths have been reported in Illinois, Kansas, Oregon, and Tennessee, and there have been 1 death each in Alabama, Connecticut, Delaware, Florida, Massachusetts, Michigan, Mississippi, Missouri, Montana, Nebraska, New Jersey, New York, Pennsylvania, Texas, Utah, and Virginia. Amid the EVALI outbreak, the CDC is doing additional testing on the available samples for chemicals in the bronchoalveolar lavage fluid, blood or urine, as well as lung biopsy or autopsy specimens. The CDC is also validating methods for aerosol emission testing of case-associated product samples from vaping products and e-liquids. There are resources and information available to you via the CDC. You can find links along with this story link in the show notes. The links include resources for the public, resources for healthcare providers, and resources for state and local health departments. Synchronizing medication refills results in higher adherence, fewer hospitalizations, and lower healthcare costs in a cohort of patients with type 2 diabetes. This is according to research presented at the 2019 annual meeting of the Academy of Managed Care Pharmacy. Investigators with Pharmacy Quality Alliance used data from the Truven MarketScan research database to conduct a retrospective cohort study of more than 20,000 patients. To be included in the study, patients needed to have 2 or more prescriptions for diabetes, excluding insulin, statins, or renin-angiotensin system agonists. About 80% of the patients in the study were commercially insured, while the remaining 20% were insured via Medicare. The researchers found that patients who were commercially insured and whose medications were synchronized did have better medication adherence compared with matched controls, and 67% adherence compared with 57% adherence. They also had lower median healthcare expenditures at about $3,700 compared with about $7,500. The researchers found similar results for patients who were insured via Medicare. Synchronized patients had better medication adherence at 86% compared with 70% for controls. They also had lower median healthcare expenditures at about $7,300 compared with about $11,000. The Daily Medical News will be right back after this. Welcome back to the MD Edge Daily Medical News. I am Nick Andrews. People with psoriasis appear to have both an increased risk of cancer as well as an increased risk of cancer-related mortality. This is according to a meta-analysis that included both cohort studies and case control studies that was published in JAMA Dermatology. The analysis includes 58 studies that were published between 1983 and 2017. There were 9 studies that reported risks for cancer among patients with severe psoriasis, and there were 7 that reported the risk of cancer mortality among patients with any severity of psoriasis. Overall, the researchers report that patients with severe psoriasis had a 22% increased incidence of cancer risk. For all severities of psoriasis combined, the researchers found an 18% increase in risk. The overall cancer mortality risk was 22% higher in patients with severe psoriasis compared with the general population. Site-specific relative mortality risks included liver, esophageal, and pancreatic. You can read more about this meta-analysis, including relative risks for specific cancer types, by clicking the link in the show notes. And finally today, advice on how to increase medication adherence among children with asthma. Up to 50% of children with asthma struggle to control their condition, yet fewer than 5% of pediatric asthma is severe and is truly resistant to therapy. This is according to Dr. Susan Laubach, who is the director of the allergy clinic at Rudy Children's Hospital in San Diego. She says that there are other factors which make asthma difficult to control and may be modifiable, especially non-adherence to recommended treatment. In fact, up to 70% of patients report poor adherence to treatment. Dr. Laubach noted that barriers to adherence could be related to the treatments themselves, saying that such barriers include complex schedules, lack of an immediately discernible beneficial effect, adverse effects of medication, and the cost. She pointed out that clinician-related barriers also influence patient adherence. This includes factors like difficulty scheduling appointments or seeing the same physicians, a perceived lack of empathy, or a failure to discuss the family's concerns or to answer questions. Some families have a lack of trust in the healthcare system, she says, or certain beliefs about illness or medications that may hamper their motivation to be adherent. Citing research by Ted Klock et al. From 2013 suggests 5 E's of adherence. Those E's are ensure. Ensure close and repeated follow-up to build trust. Explore. Explore the patient's views, beliefs, and preferences. Express. Express empathy by using active listening techniques that tailor to this patient's specific needs. Exercise. Exercise shared decision-making. And evaluate. Evaluate adherence, but do it in a non-judgmental way. Dr. Laubach suggests that clinicians have an honest discussion with patients about potential benefits and potential risks of corticosteroid use in children with asthma. And that concludes this edition of the Daily Medical News for Monday, November 4th. I'm the voice of MD Edge Podcasts, Nick Andrews.